Hello, everyone. My name is Madeline, and me and my 3 other co-founders make up Chemo Solutions. So, how many of you guys have known someone who's had cancer? Yeah, I have gone through that experience as well. My grandpa actually had pancreatic cancer when I was in middle school. And since I was really close to him, it was hard to see him go through this and see all of the side effects that chemotherapy brought to him. He unfortunately passed away, but he was a big inspiration into me going to study biomedical engineering. So while studying biomedical engineering, I was able to have a mentor in the radiation oncology department, and we figured out together that there is a major problem in the chemotherapy community right now, and that is neuropathy. So what this means is that when the chemo enters the bloodstream, it'll sit in the hands and feet of the patient and eat away at the nerves, as you can see in this image over here. It's a big problem, and 68% of chemotherapy patients actually get this disease. But right now, it's kind of unheard of for a lot of patients. I talked to them, they didn't know that this was a side effect for them before going into chemotherapy. So that's one of my goals, is to help educate these patients. What I heard from the patients who have experienced this neuropathy is that it can be anywhere from like a tingling, numbness sensation, all the way to this burning and stabbing pain that they have to live with for their entire lives. I've also got patient quotes saying it feels like wearing a glove with bees inside, or like walking on broken glass. That's why Chemo Solutions is in the process of creating a prototype that uses cryocompression. So what this means is, imagine one of those ice packs that you get post-surgery that has the water in them over here, and like a blood pressure cuff together. And you can actually see me there wearing our prototype, testing that out. And the unique value proposition of our device is that it's preventative. So there are a couple treatment options that patients do have. They're not great, but they are there. But there's no preventative device on the market yet. And the reason for that is that a lot of other companies have tried either the cold or the compression, but not both together. So if we put both together, we're able to create a safer environment for these patients. And as you can see here, this is a scale actually for a thermal camera. This is our testing of the device. This is actually one of my co-founders' arms without the treatment. And then with treatment, you can actually see that we're getting down to around the 23 degrees Celsius range on the arm, which is what we're aiming for. So that's exciting. Our business model is, our goal we want to go through is being health insurance. So that's actually what we're working on right now, is being able to talk to those different companies to get their approval. And then we also need to be prepared for any hospital-specific requirements, as a lot of hospitals are run as individual businesses, so their models of purchasing devices are different. We also have the option of licensing our device or selling our patent to another medical distributing company. And then we have to keep in mind all the associated costs, such as clinical trials and patent filing, which we are in the process of doing right now. As I mentioned before, there are some treatment options, and the main one right now, the current standard of care, is called gabapentin. And this is kind of like a painkiller. It targets the nerves and tries to ease the patient's pain. But I've talked to many patients and they said that this does not work. There are a lot of side effects. But as it is an option, I would like to keep it in mind. Know that it is my competition. As far as who I'm targeting, I will want to keep in mind the influencers of oncologists, as they are going to be the ones who are telling the patients that this is the device they should get. So I can market to them through medical journals and then through a direct sales team. There is a great financial potential for my business. As you can see here, Unfortunately, the cancer population is steadily and rapidly increasing. And just the chemotherapy group has an 11% annual growth rate. With this, although with this, the patients who do have the neuropathy, which again is 68% of them, are spending an additional $13,000 per year, and potentially could be a lifelong $13,000 per year. And with our device, we plan to reduce this cost for the patients, but it also still has a great profit margin for us as well, as we're expecting $91 million a year if we only get 5% of that chemotherapy market. I just wanted to put up here that we've had a lot of opportunities for competitions and awards, some of them being monetary. We're also very proud of our advanced prototype going to clinical trials. And I've done some customer discovery this summer and want to do more. So over the next 90 days, my goal is to talk to patent attorneys and figure out the patent filing for that. I'm actually meeting with someone this week, so that's exciting. And more customer discovery, especially with the insurance companies, and a bunch of other things over here. So, as I mentioned before, I want to do more customer discovery. So my ask of you is, if you know anyone, please come and talk to me afterwards. I also have a GoFundMe. I'm traveling to Florida this weekend for an oncology conference. So if you'd like to help donate more to this and potential future conferences, I would be very grateful. In conclusion, this neuropathy is a major issue. And while my company has great financial potential, I also want to point out that I'm most excited for being able to help all of these patients. So thank you.
Any questions? So my first question is, how does it work? So you can explain like how it works. Does it concentrate your blood vessels so that blood doesn't go on?
Yeah, so that's a great question. I'll explain it a little more. Our device is going to be an arm wrap, as you saw me wearing it, and the patients will wear this during their chemo infusion while at the hospital. So just a couple of hours. And it'll use the cold and the compression to help push the blood back to the trunk of the body, where we want the chemo to be.
So we find that if I put something like on my neck, with the chemo medicines will be educated here on just an hour, but it's not going down to the legs.
Yeah, so their blood will still flow, otherwise that would be bad, obviously. But it'll help keep all the chemo drugs from sitting in those like tiny little capillaries you have, because the other blood vessels are larger throughout your body, but in the hands and feet, it gets kind of small and chemo drugs sit.
What about the schooling system? What is its purpose? Like you said that you have a bio system.
Yeah. So both of them do the same thing in shrinking the blood vessels. So cryo and compression. Yes.
Did you say that there's no other option that has both of those together too? So there's only like one or the other?
Correct. Yeah. And I'll expand upon that. What we've seen in the clinical trials that have failed is that, for example, if they're using just cryo, they have to get the temperature so low to get that blood vessel constriction that it's causing frostbite. So that's why we're using both and why that is safer for patients. Yeah.
Can this only be used then for cancers that are like in the trunk or whether in the trunk? Is that right? I'm not an MD, but that.
Yes. So this type of neuropathy is most common in certain types of cancer drugs. And those drugs are used for mainly breast cancer, GI tract cancer, and colorectal. So while it happens for all types of cancer, those are the ones we're targeting because it's most common and most devastating in those situations. Yes.
Can it help for people who suffer from neuropathy but not related to cancer treatment?
We're considering that as an expansion of our business as we're moving forward, since we will be able to have that background in neuropathy. But with our device, since it's preventative, it will be just for the chemotherapy situation.
Will the cancer patients use it only, like, not just during chemo, but can they use it, periodically just to circulate their system after to help with the neuropathy post chemo treatment?
So chemo actually has a pretty quick half-life. So while the patients are being infused with the chemo, that's when it's most dangerous for them. And so we'll have a little period before and a little period after with the patient wearing arm wrap as well. But that's just to make sure that all the chemo has essentially been used up in the body. So it's not really an issue when the patient is not injured.
I know there's probably a ton of like requirements and stuff that you need, but what's your like timeline look like from now until you can like try out the and how when you've already done that?
Yeah, no, that's a really great question. So right now we are applying for clinical trials, and this it's really up in the air because of COVID has affected a lot of the hospital systems. But we're hoping to get into clinical trials by the end of this year, early next year. And then depending on what data we need, this should be a year or so, we'll have a patent filed then. So that'll be taken care of. But once we go through clinical trials, then it's additional 3 to 5 years in the FDA approval process. So we're looking at 6 years or so.
No. What's the number one insight that you've seen from talking to healthcare professionals in this space, and also for patients who are undergoing or potentially have undergone therapy?
I've gotten a lot of good insights, so I'm trying to pick the top one. So I was actually able to talk to an oncology nurse, and she was very helpful in the design considerations of our device, because there were a lot of things that I didn't think of, like make sure it has a different buzzer sound than other equipment, or make sure the cord's really long. So little things, but things that make a huge difference for the nurses who are already really busy. And then as far as patients, what I'm hearing is like the gabapentin isn't working for them. They wish they had another option. But like I said before, they don't really know about it going into cancer. So making sure that these patients are aware that this is a potential side effect and they do want to use our device. Yeah.
Similar with health insurance being the major stakeholder. If I understood and remember correctly, you're taking the lifetime annual cost from $13,000 down to $3,000. I would think that would be a pretty important factor. What have you heard from insurers that you've talked to?
So we're just getting into talking to insurance. We haven't heard anything definitive yet. But obviously with those numbers, they are excited. And I think that they would be a good deal for them. Yeah. You had a question?
Would you have to change the dosage of the chemo then? Like, so if you're taking the drugs, the chemo away more from the extremity and trying to keep it more in the trunk, then could that increase the likelihood of side effects in those areas? You know what I'm saying?
Yeah, that is a potential that we do need to consider when going through clinical trials. But when I talk to physicians, what they also could do is if patients are experiencing the neuropathy, they do cut down on the dose to help with that. But then the therapy isn't as effective because of that reduced dosage. So essentially what oncologists are wanting to do is get as much chemo as possible to those areas with minimal side effects. So if we're able to reduce this, that would make them very happy.
So my question is more that if you're trying to target like the liver or the pancreas, right? And this device is keeping the blood flow from the extremities, right? And so then would the MD need to decrease the chemo because it's not going to be in the extremities, more the drug's going to be in the trunk. So that then like the liver or the pancreas are going to experience more of the chemo, and that could then increase some of those side effects.
Yes. So short answer, no, they would not have to decrease that. They want as much chemo as possible in those areas. So if it's going to the trunk and it's a higher concentration of chemo there, that better.
So how long the patient have to use this device? When I session of the chemo or different time for that?
Yeah, so the patients that we are targeting usually have 4 to 8 rounds of chemotherapy, and they will wear the device during each round. So we would put the device on 30 minutes before. They would wear it for the duration of treatment, roughly 3 to 4 hours, and then 30 minutes after. So it would be 4 to 5 hours of them wearing the device.
And do you have any specific size to keep the device with your hands and the legs, something like that?
Can you ask that again?
Yeah, so do you have any specific size you have to use the device specifically?
Any site?
Yeah, on your hands or your legs.
Okay, so we're working right now on the hands because the arteries are right here and they're really easy to target. Whereas in the feet, the arteries are kind of hidden. So we wanted to have a proof of concept first with the hands. So you would wear it both around your forearms and then eventually around your ankles. And we did keep in mind patient comfort. That was a huge factor for us because they're already in a really uncomfortable situation sitting for several hours. So we did keep in mind patients being able to do their normal activities like reading or being able to get up and walk around.
I was going to ask about your target market. You mentioned oncologists, but what about the nurses? Is that something you're finding easier to talk to the nursing staff that's maybe providing more direct patient care?
Yeah, so this summer, especially, I'm really interested in talking to oncologists, nurses, and patients. Those are my big 3. Why I chose oncologists to target is because they're the ones who would prescribe the device, but it's also really important for us in the future to maintain that that company and nurse relationship, because if the nurses aren't going to want to use it, then it's not going to be used because they're the ones who are going to have to train. They're the ones who are going to actually be putting the device on people and telling oncologists whether they like it or not. So yeah, so we need to keep that in mind as well.
Any other questions? If not, I guess I'll do our usual final question here at 1MCIOC. What can we as a community do to help you?
Yeah, so I have my final slide here. You can donate to the GoFundMe. It's like anything helps. $10 would be perfect. And I'm also really interested in talking to those customer segments that I was described earlier: oncologists, nurses, patients, and then health insurance companies. So if you know anyone, please come up and talk to me. I'd love to get their contact info. Thank you.
Thank you very much.